And welcome back to Body Beautiful. Plastic surgeon Dr. Joseph Mealy is here with me today, and we're talking about plastic surgery after weight loss, one of the topics. Let me remind you first that we're going to be taking your calls live. Any questions you might have for the doctor about plastic surgery, the phone number 800-440-4884. We'll also be posting his number for his office during and at the end of the segment. And of course, our caveat here, any advice, any information you're hearing today, you're certainly going to want to double check it, consult with your own physician as well before you go about doing anything. During the break, we had Leo from San Francisco who had a question for you, doctor, and he wanted to know who has more plastic surgery, men or women?
Men or women? Well, women. About 85% to 15%. So,
is it vanity?
I don't know.
Men
if
are
vanity,
catching up, though, right?
Men don't get pregnant either, so the issues with the stomach are totally different for men than for women.
There is one man who did get pregnant. He gave birth, if you recall.
Yes, well, he's actually pregnant again, I think.
Yes, again.
Yes.
So may need to look into, if there's a lot of stretching. Okay, I'll let that one go down.
There you go.
But more and more men are having surgery, plastic surgery, to stay competitive in the workplace and, whatever.
Yeah.
Okay.
No, I think eyelid surgery is something that both men and women have quite a bit of, but there are certain parts of the body that men don't get operated as much as women, so that certainly gives women an advantage in terms of numbers.
Okay, and I was going to say, breast surgery, but actually no, because there are some conditions that men have where they are developing breasts, and you do that.
But certainly we do the vast majority of our breast surgery on women.
Yes, certainly. Okay, let me ask you, for somebody who's lost a bunch of weight, and this is really what we're concentrating on today, like the bariatric surgery, does the plastic surgery complement that? Is that necessarily what you need to be looking at if you're going to lose a whole lot of weight?
Sure, it can complement it. And one of the things I didn't mention in terms of what adjustments the body can make after massive weight loss is age. Younger patients tend to do better. So for my younger patients, if they're getting on to their weight loss early in life, they're less likely to have that extra skin. So it's an incentive to, if you're going to do it sooner.
Okay, so
as we get older,
it just springs back better.
Yeah,
right?
we lose some of the elastic fibers, so our skin doesn't recoil as easily.
Okay.
But I think of plastic surgery as a complement. My patients work very hard. They lose a lot of weight. They feel good. If they're having trouble with blood pressure, diabetes, usually that's better. They're much more healthy. And they want to feel like they earned it, and they want to look like they feel.
Now, we're not talking about this as a replacement for exercise. This is if exercise is not working for you. Yeah, okay.
Right, no, it's not. It's a good complement, though, if you've got all those things working for you.
Okay, we've got Cheryl on the line from Stockton. Good morning, Cheryl.
Good morning.
Do you have Hi, do you have a quick question for Dr. Mealy?
Yes, I do.
Okay, you're on the air.
Yeah, I was wondering, what can I do to have some excess skin removed? Because I used to weigh 298, and I dropped all the way down to 178, and I've been asking my doctor that had done surgery on me for hernias and everything, and he says, well, you need to lose more weight, and I've been losing some more weight. But the thing is he goes, well, it's not my place to do that.
I see. Well, first of all, congratulations on losing that much weight. That's a lot of work, and you should be congratulated on that. In terms of removing the extra skin, the doctor you're talking about, the doctor who did a hernia surgery is probably a general surgeon. You may want to consult a plastic surgeon so that they're a little more focused in terms of what plastic surgery can do and can't do. And it depends on where the weight is, and it depends on your goals. It's nice if patients are close to their ideal weight. So I think then when we're done, everyone would look at it and say, oh, we've done a good job, everything looks nice. If you've got a little extra weight and we do these types of surgeries, it may still look a little full and a little bit round. And sometimes that's good. Sometimes that's, the best someone's going to, the lowest someone's going to weigh, and it's going to make them feel good, and it may provide motivation for them to go further. But it's an individual decision. It needs to be made in consultation with your regular doctors, your plastic surgeon, yourself, and such.
Okay, thank you, Cheryl. And that somebody is to be really applauded for losing that much weight.
Unbelievable.
It's not an easy thing to do.
It definitely isn't, especially, if you live in the world where they have advertisement for food every 5 minutes, it's hard to avoid.
Yeah, definitely. And so what would you say, what's the best time to have any of these body shaping procedures after you've lost a lot of weight? Do you want to wait a certain amount of time to see if the body can readjust and do it itself?
Yeah, I think that's worthwhile, especially with these massive weight loss. And specifically in the situation where someone's had bariatric surgery, they've gone through a big surgery. And that surgery does two things to help them lose weight. One is it restricts the amount of food they can eat, and the other is it causes a bit of malabsorption, which means they're not absorbing all the nutrients that they eat, which also means they're not absorbing all the calories, so they can lose weight. Most recommendations are to wait at least a year after that type of surgery so that the body can adjust physiologically. It will heal better. There are fewer complications with infections, wound healing, those sorts of things.
Okay, we've got to go to break, but for more information about Dr. Joseph Mealy, you can call 925-943-6353 or go to drmealy.com. And when we come back on Body Beautiful, we will continue our chat with Dr. Joseph Mealy, and we'll be taking your phone calls, I promise.